You're listening to Soundside. I'm Libby Dankman. In a hospital or other medical setting, if staffers think a patient is violent or threatening, they may restrain them to a hospital bed or inject them with a sedative. In some cases, they might also use something called a spit hood. This is a mesh or cloth covering that goes over the patient's head. It was patented for law enforcement to use during arrests. Critics of these devices consider them dehumanizing and in some cases dangerous. In the past decade, at least 5 people in the United States died in medical care incidents involving spit hoods. And the FDA does not classify them as medical devices, which means they are not subject to safety regulations. This all comes to us in a new investigation from the Seattle Times. The reporting looks at how spit hoods are used in medical facilities across the country. Hannah Furfaro is a mental health reporter at the Seattle Times. She's the journalist behind the investigation called Shrouded in Secrecy. Hannah, welcome. Thank you very much for being here.
Thanks for having me, Libby.
So why did you start looking into the use of spit hoods in medical settings? What started you on this investigation path?
I found out that a local healthcare facility in Washington was using spit hoods. This is a psychiatric facility. And when I learned this, I was only familiar with spit hoods in the context of police. Manny Ellis died in police custody a couple years ago after being hogtied and hooded with a spit hood. And so I knew what these devices were, but as someone who writes about healthcare, I'd never come across them. I decided to do a little bit more investigating and find out if this facility was unique. And so I started asking around. I reached out to DSHS, which is the agency in Washington that operates the state-run psychiatric institutions. And I found out that they also use spit hoods in some of their facilities. And so I decided to cast a wider net. I reached out to a number of private facilities here in Washington and started looking through lawsuits and news clips around the US. And at first, I didn't find much. Unlike law enforcement, which is subject to public records, the medical care system is not. So it was kind of hard to get a pulse on how common these devices were. So ultimately, I decided to do a survey of all 50 states to better understand how they were being used in state-run psychiatric facilities. And then I did a much deeper search of lawsuits and hospital inspection reports and media clips.
And how many states did you actually get information from in the end?
Yeah, so through our survey, we heard back from 29 states. And of those, there were 15 that said that they use taxpayer dollars to pay for spit hoods at their state-run facilities. In all, we found that 29 states, some of which responded to the survey and some of which did not, have used spit hoods in some way, shape, or form, either in ambulances or in psychiatric facilities or in ERs over the past decade. And so those other states that we found, the way that we did that search was just by looking through, again, media clips, lawsuits, and that kind of thing. And then, of course, there was a number of states that did not respond to our survey and that we did not find any other information about.
And I should note, too, that you also interviewed more than 30 medical staff, patients, civil rights advocates, and legal experts for your reporting. What about Washington State? What did you find about the use of spit hoods and how often they're used in Washington?
That's an interesting question. It's a difficult one to answer because there's no data on how, when, or why spit hoods are used. They are not tracked systematically here in Washington State, and of all of the states that responded to the survey, no states said that they track spit hoods. They might track when patients are put into seclusion rooms or they're restrained in other ways, like with ankle and wrist straps, but no one is looking at spit hoods specifically. So one of the things that I ended up asking the state of Washington, that agency that runs Western State Hospital and other state facilities, is if they had information elsewhere. And it turns out that in some patient records, it's noted when a spit hood is used. And so the state of Washington ended up doing what they called a cursory search of their own records. And this involved essentially a word search. And they came back to me and said, somewhere over 140 times in the last 7 or 8 years, they found the word spit hood or spit or something that implied that a spit hood was used. It's really hard to know what that tells us, to be quite honest. And it's hard to know generally about use in Washington because there are so many private facilities, and we really have no statistics or information from those places.
So it's hard to get data, but I know you interviewed people who are, medical staffers and other folks who have knowledge of spit hoods and their use. So what did you find about generally when they're used and why? I think I'm asking because, being a nurse is a difficult job, being a staffer in a medical facility. And I would imagine that there are times when a patient is in psychosis or having some other episode and they might bite or they might spit, and that can be a safety hazard for medical staff. So what did you hear about when and why they're used in medical settings?
There was one facility that I was looking at in particular, and I interviewed a number of people who were involved in restraints. And so these are people who were directly working with patients every day. These are people who were, sometimes kicked, pushed, punched, and sometimes spat on, as you said. These are incredibly traumatic jobs to have. And, sometimes folks who especially work in these inpatient psychiatric facilities have worked in higher security places like Western State Hospital. Some people have worked in prisons and jails. These are people who are maybe coming into the job with a lot of trauma. Similarly, in ERs, there are a number of people who take these jobs because they want a position where they're caring for others. They may not have the psychiatric training that someone has if they work in a psychiatric facility. But again, they are working with these patients. And so if someone comes in to an ER or they're in a psychiatric facility and they are experiencing delusions or hallucinations or they're scared, they might act out. A lot of these cases, these people are here involuntarily. And our mental health care system, it's something that I've been writing about for more than a decade. And I think you probably know this. There are so many issues with the way that we run this system. And I think patients are certainly on the front lines of that in a lot of cases. And so to be scared or to feel confined is not a unique experience. And so to fight back, I think, is also not something that's really unique. And unfortunately, healthcare workers end up being on the receiving end of that a lot of times.
The practice is controversial to use spit hoods on patients in medical settings. What are some of the biggest concerns that you heard raised about spit hoods?
There are a lot of concerns. One that came through over the course of the reporting is that there's no regulation. So unlike Band-Aids or medical gloves or medical masks, which are regulated by the federal government, you can buy these hoods on Amazon or Walmart. Anyone can buy them. They can essentially be used anywhere. There's no rules around how they're advertised or even the instructions that come along with them. As part of my reporting, I ordered a number of spit hoods, just a number of brands, just to kind of see what they look like and felt like. And some of them came without any instructions. And sort of related to that, another thing that came up is that there's no required training for folks who are using spit hoods on patients. So the federal government doesn't have any rules and regulations. States don't have them. Some healthcare facilities might, but they're inconsistent. And whether staff are actually trained is also inconsistent. Then there's the safety piece in general. There's very little research on spit hoods, whether they work and whether they're safe. I think that, some of the healthcare workers who I spoke with, they pointed out, especially the mesh hoods, they're pretty porous. When you put them on, I actually tried this myself. I put on a mesh spit hood just to see how well I could breathe. And it was not difficult to breathe through it. The one with the fabric covering was a little bit more difficult, but their point was, if we don't know how to use this safely, then people can use it in an unsafe way. And certainly we found a lot of cases where healthcare workers were unfortunately using these hoods to restrain patients' heads or their necks. And so when you combine the lack of regulation, the lack of training or instructions on how to use this, and then the lack of oversight in general, I think that's where people start to get concerned.
I mentioned at the top of the conversation that at least 5 people in the United States have died in medical care incidents that involve spit hoods. Do we have any more information about those cases? Like, was this a situation where airways were constricted because of the spit hood, or what do we know about that?
Each of those cases is pretty unique. And I think that one of the things that came through as I was looking at each of those cases is that mention of spit hoods, whether it was in a lawsuit that was related to the death or in official death investigations. The spit hood was often mentioned in an offhand way, but in some of these cases, ultimately the person was deemed to have died from asphyxiation. And so, in one of the cases in particular in the state of Wisconsin, a patient at a psychiatric facility died after being restrained at the neck and turning blue, with a spit hood on. And so, I think it's one of the pieces that was really challenging with the reporting is tying spit hoods directly to injuries and deaths. That's something that, as a journalist, I let experts sort of speak to those dangers because there's so little data, and what you can glean from these individual incidents is it's kind of tough to draw conclusions. But I think when you look into the details, you'll start to see some connection there. There was another case where a person was in an ambulance and was experiencing a mental health crisis and was hooded. And there's video from that incident. And if you watch it, it's really, really difficult to watch. But as this patient became unresponsive, the EMT who was there in the ambulance with them, asked them multiple times if something was going on, if something was wrong, but their head was covered and they were unresponsive. And so I think that kind of speaks to an issue that came up in my reporting, which is some healthcare providers said you just don't know what's going on with someone when their face is covered. You can't see if they're turning blue. You can't see if they're not breathing. And so I think that was something that I was thinking a lot about in terms of the dangers as I was writing and reporting the story.
In Washington state, there is a policy around spit hoods and their use by law enforcement, by police. They're not supposed to use spit hoods on certain populations, people who are struggling to breathe, for example. Are there any similar regulations or rules around spit hood use in medical settings in Washington?
The short answer is not yet. Let me explain a little bit what I mean by that. So when I was asking the state of Washington about their use of spit hoods at Western State and other facilities here, there's a lot of back and forth with state officials over the several months that I was doing this reporting. And in October, I had a conversation with some state officials who said that they were working on writing a spit hood policy. So the state of Washington did not have a spit hood policy at that time. And assuming that policy is finalized, the idea behind it is that spit hoods will now be considered a restraint in the state of Washington. So as of right now, it's Friday, January 30th. I don't have confirmation that the state of Washington has a statewide spit hood policy. As I said, I know that one is in the works. And if it is finalized, that's something that I would certainly want to write about.
I'm talking with Hannah Furfaro, a mental health reporter at the Seattle Times. She is the reporter behind a major investigation about the use of spit hoods in medical settings. So these cloth coverings, mesh or cloth, that are used to restrain patients, to prevent them from biting or spitting in medical settings. They were made for use in policing, but they are used in medical settings. And Hannah reported on the issues and safety related to that. Hannah, your reporting after it was published, obviously people had big reactions on social media. And we went through kind of the Facebook page reactions that the Seattle Times Facebook page had. A lot of people basically saying, I work in medical settings and these spit hoods are for protection, they don't get used unless it's necessary. I want to read a couple comments. This person says that just because we work in a hospital doesn't mean we should take abuse. This person says, have you ever been spit on, bitten? I'm guessing not. As someone who works in an emergency department, we're allowed to protect ourselves. I can assure you spit hoods are not used unless needed. When they are used, typically a patient is on a watch, meaning they are being constantly observed. This piece is ridiculous. Now, as reporters, we're used to getting pretty strong reactions to our reporting, and I know you've developed a thick skin over the years, but I'm just curious what you make of the reaction and how you're engaging, I guess, with, people who are commenting on your work and what your take is on all of this.
I did read a lot of those comments and I was struck by them for a number of reasons. I think I'd say a couple things. Generations of journalists, whether they understood it or not, contributed to serious stigma against people who are experiencing mental illness. A lot of the journalism in the 60s, 70s, 80s, and even 90s, even the 2000s, portrayed people who are experiencing mental illness as violent. And my work as a journalist has been instead to look at systems problems that affect people who are in this situation. And so, the Seattle Times has written a number of stories about the dangers that healthcare workers face in their jobs. Healthcare workers, as you point out, they do not deserve to be in danger in their work. They do not deserve to be spit on. Unfortunately, they are in settings where this can sometimes happen. And so the nature of this reporting and the purpose of this investigation was to look at the tools that they do have at their disposal. And this reporting found that this tool that they have, one of the only tools they have, is unregulated. And so, I think it's natural for people to have a strong reaction when their status quo is challenged, especially for people who got into work with passion and dedication to helping people. When I read comments like that, I think about them a lot, and I, like anyone who writes to me, I think about how that perspective, could help shape my future reporting. I spoke with a number of people over the course of this investigation who were in the same position, presumably as the folks who were also in the comment section. These are people who were responsible for seclusion and restraint, and in many instances found that they didn't have the training to use these spit hoods in a way that they felt safe to do so. There were a number of folks who couldn't believe that that was part of their practice. I got many emails from folks, healthcare providers, who said, kind of the opposite of what you see in the comment section. Things like, I've saw one of my colleagues put not one, but two spit hoods on a patient one time and was horrified by that. I got comments from families of teenagers who have wound up in the emergency room who said, I think stories like this could save my kid's life because I have no idea what would happen to them, in a medical setting. So I think that, the comment section, certainly there were a lot of people who were sort of in community with each other, but I also heard from people sort of offline who had really different perspectives.
Before we go, Hannah, you talked about the fact that Washington's Department of Social and Health Services has begun creating a spit hood policy, and as we're speaking right now, they may be finalizing it. What about the future of these in Washington State? Is there anything else people should know? Like, what about healthcare facilities? Are they rethinking the use of spit hoods? Anything else for folks to know?
Yeah, over the course of my reporting, I did end up speaking with some folks who told me that Harborview Medical Center, so one of the major medical centers here in the Seattle area, that they had spit hoods in their emergency department. And so I did reach out to Harborview, and I ended up talking with officials over the course of several months of my reporting. And, Harborview ended up getting back to me at some point months on in the reporting and said that they were going to stop using spit hoods as of October 2025. And so Harborview has stopped using them and said that they use them pretty infrequently anyway. They also said that the Seattle Times reporting was not directly related to their decision to use spit hoods. Their policies and sort of documents that they shared with me show that they had been using them for the past 20 years.
Hannah Furfaro, the reporter behind Shrouded in Secrecy, a new investigation from the Seattle Times that looks at how spit hoods are used across the country in medical settings. Thank you very much for being here.
Thanks so much.
Thanks for listening to Soundside. Don't forget you can listen live on KUOW 94.9 FM Seattle at noon and 8 p.m. Monday through Thursday, or anytime online at KUOW.org or on your favorite podcast app.